Hello, my name is Dr. Anubha Sinha. I'm a board-certified gastroenterologist, founder, and president of Hunter and Digestive Health Specialist. I have been practicing over 20 years. The question I get asked the most is, who should get a colonoscopy? And today I want to break down into 3 primary reasons. The first reason to have a colonoscopy is for colon cancer screening. Worldwide, colon cancer is the second leading cause of cancer death. Colorectal cancer is the third most common cancer in the United States. It is the third leading cause of cancer-related death as well. Approximately 60,000 people die each year from colon cancer, which shouldn't be the case. Colorectal cancer is preventable, beatable, and treatable when diagnosed and treated at an early stage. The average risk person should start getting screened for colorectal cancer beginning at age 45. Colonoscopy is the gold standard test of choice because it allows us to find and remove small polyps and growth before they have a chance to turn into cancer. It is recommended that individuals from all ethnic groups, African American, Caucasian, Asian, men and women alike, begin colorectal cancer screening at age 45. Prior screening guidelines advised starting screening at age 50. However, due to a rise in colorectal cancer in the younger populations and a rise in colorectal cancer deaths from these often more aggressive cancers, screening guidelines have changed, and all individuals are advised to initiate colorectal cancer screening with colonoscopy beginning at age 45. If you have a family history of colorectal cancer, or personal or family history of other types of cancers, or genetic syndromes or other diseases such as inflammatory bowel disease, it may be advised that you should start your colon cancer screening sooner. Always check with your individual healthcare provider for appropriate medical advice. The second reason is to evaluate certain types of symptoms or lab findings, such as change in your bowel habits, rectal bleeding, unexplainable abdominal pain, persistent diarrhea or constipation, and weight loss, and iron deficiency anemia in your lab results. The colonoscopy helps us to identify the cause or source of your symptoms, such as colitis, inflammatory bowel disease like Crohn's disease or ulcerative colitis, hemorrhoids, or even colorectal cancer. Finally, the third reason for colonoscopy is to follow up on another positive colorectal screening test, such as positive stool DNA, also known as Cologuard, or positive stool occult blood test, also known as FET. The second question I get asked frequently is, when should I get a colonoscopy? Again, new recommendations states that average risk men and women initially be screened for colorectal cancer beginning at age 45, not 50 but 45. Above average risk person with a family history of colorectal cancer, genetic syndromes, or a history of inflammatory bowel disease may need to begin screening earlier than 45. Bowel preps and sedation today are much gentler and easier than they were in the past. Don't let your concerns regarding your colonoscopy prevent you from having your first colonoscopy. It's one test that just might save your life. Take care of yourself. Get screened now.